discussion. So the next talk will be by Dr. Rakhi Dcruz on learning from your mistakes and keeping a logbook. She is a consultant phaco surgeon at Chaitanya Eye Hospital, Kollam.
So, good afternoon, everyone, and this is a session on how to learn by yourself from your mistakes and keeping track of your mistakes and learning SACS better way via a logbook. So, the only real mistake is the one from which we learn nothing, said by Dr. Henry Ford. So, how to learn from our own mistakes? You have to reassess your surgical steps and grade yourself along with your trainer. Review your surgical videos and learn from those mistakes. Keep a track of your improvement via a logbook. There are different systems for surgical proficiency available, which includes the IC15 system and OASIS system. So what happens in Kerala and in most of the places inside the India is that an ophthalmology resident should be at least confident in SACS independently at the end of surgical residency, which does not happen. And the main way how a surgical competency is assessed is by auditing the surgical cases post-operative outcome. That is, they assess only the visual outcome post-operatively as a criteria to know whether that surgeon is proficient or not, but not the stepwise surgical performance. I think that is not right. The right way to do it is via the ICO rubric system. The ICO rubric system is called as a rubric because it breaks down an operation into separate steps and sets clear guidelines for different level of skill with which each step can be performed. So this will help to track your performance as well as to keep your record. So this paper by Ashok Grover and Santosh Hanover has also said that this ICO rubric system should be incorporated in the NMC based ophthalmology curriculum. So this system is available not only for cataract, it is available for almost all the specialities. So this is an example of ICO rubric system available easily online. Just download it. So it starts with draping up to the end of the surgery. So just look at one of this, corneal entry. So if you are hesitant with the keratome entry, you are unable to extend the internal wall. You can assess yourself. There is shallowing of the AC in between. That means if you have a trainer or a senior with you, they will give you a score of 2, or else you yourself can give you a score of 2. That means you are just a beginner, novice. And then goes to the second step where you can enter AC with a difficulty. You create different plane. That means you are still a beginner, but you enter at the right plane, able to extend, but you have to repeatedly use viscoelastic and your internal wall is still irregular. You are at a stage of an advanced beginner. That means stage of 4. And if you are competent, every step will be smooth. There will be a self-sealing good SS wound. That means you have become competent. So from this you will know what is expected from you at each and every step. You can grade yourself, or if you have got a trainer, that person can also help you to grade yourself. This is not only available for the steps, it is available for the global indices like the eye positioning by the surgeon, the iris protection, the overall speed and fluidity of the procedure. It is available for phaco also, a very detailed stepwise, so that you will know what is expected of you with phaco also. Then there is another scoring system which is known as the OASIS scoring system, and here there are 3 aspects. They grade your preoperative, intraoperative and postoperative aspect. So what happens post-operatively? They will look at the astigmatism that you have created, the rate of complications of individual residents, the cohort of patients, like if you have operated on a pseudo-exfoliation patient or not. So everything will be assessed. Now, if you don't have all of this, there is a simulator-based assessing system which is known as IC. But this simulated assessment model correlates well with the real-life metrics and can thus work as an effective tool for surgical competency. This is available as an app also. You can download, you can practice in that, and you can grade yourself. Now, the next step, that is learning by reviewing. That is by a surgical video record. This is one of the pictures of my friend Sunitha itself operating. So, what all we can learn from this? You can learn how the surgeon holds the instrument from outside. You can also learn what is her positioning on the microscope from the outside, right? So all these things you can learn from outside, but you have a surgical video recording system. That is the best way. Record your initial surgeries and try to review them with your mentor or a senior. Try to find out the steps that went wrong, ask for suggestions. Make it a habit to rewatch your own videos. Even if now you are an advanced beginner or you are practicing independently, make it a habit to rewatch your videos. You will yourself find out several mistakes. So watch with senior surgeons instrument handling and hand rest position from outside also and learn. So logbook is a very crucial if you are a postgraduate, because this is very important when it comes to applying jobs internationally as well as fellowships internationally. It should be properly signed and sealed by the director of institute. So this is my own logbook. So this one also follows the ICO rubric system at our place. So here, this is one of the pages of a FACO that was done by me. You can see the trainer gives a score, the trainee also gives a score. And the trainer gives comments like overall fluidity is not good, should learn the cracking properly. There are difficulties with proper power modulation. So that is like, you know what steps you have to improve, what you want to refocus on. And if you don't want to write it down, you can actually create an Excel logbook in your phone. This is the one I had created when I was doing my surgeries. So this is an SACS logbook. Just enter the demographics, preoperative visual acuity, what is the lens grade, what were the preoperative things like the patient had brown cataract, pseudo exfoliation or not, which surgery was done, what was the IOL power, what were the difficulties. This you can write soon after your surgery. Surgery കഴിഞ്ഞ് ഇറങ്ങുന്ന ഉടനെ തന്നെ ഫോൺ ഓപ്പൺ ചെയ്ത് അവിടെ എഴുതുക, അല്ലെങ്കിൽ യു വിൽ ഫോർഗെറ്റ്. സോ ദാറ്റ് വിൽ ഹെൽപ്പ് യു ലൈക്ക് എ ഗോ ടു ഡയറി ടു നോ വാട്ട് സ്റ്റെപ്സ് നീഡ് ഇംപ്രൂവ്മെൻറ്റ്, വാട്ട് ആർ ദ തിങ്സ് ലൈക്ക് ചില ടിപ്സ്. അപ്പോൾ നമ്മുടെ ട്രെയിനർ പറഞ്ഞു തന്നതാണ്, ഇവിടെ ഇച്ചിരി കൂടെ വിസ്കോ ഇട്ടിരുന്നെങ്കിൽ എളുപ്പമായിരുന്നു ഇൻറ്റേർണൽ എൻട്രി ചെയ്യാൻ. അപ്പോൾ ആ ടിപ്സ് അവിടെ ഒന്ന് എഴുതി വെച്ചാൽ ഇഫ് യു ക്യാൻ ഗോ ബാക്ക് ആൻഡ് ലുക്ക് അറ്റ് ഇറ്റ്, ഇറ്റ് വിൽ ബി ഈസി ഫോർ യർ നെക്സ്റ്റ് കേസ്. So you can actually just download Excel in your phone and try to create a logbook like this also. This was another one which I created for FACO also. So if you don't want to make your own logbook, this Royal College of Ophthalmology site is having an online ready-made logbook, iLogbook, which can be downloaded easily and you can start entering in that also. And there is another book of logbook by A.K. Kurana sir, which is also available. So mistakes has the power to turn you into something better than you were before. So person who has never made a mistake never tried anything new. So try to make mistakes, but try to learn something from that. Thank you.
Thank you, Dr.